Yes.
So I introduced a component of education, music education, in that we would study composers or particular styles of music, and then it would be like a 10-week course, and then the people would get a diploma at the end, and that was really successful for people in a extended care who wanted, to continue to learn, and so the learning maybe, wasn't at the level that it would be in other facilities, but it gives you the sense of accomplishing something.
Yeah, it's
So,
like
yeah.
normalization.
Yes, exactly,
right?
yeah.
So, given your, I guess, this is, if the camera works, it seems weird now. It's kind of your opportunity to make a kind of visionary statement, like speaking to people who are going to work in the mental health field. What were the takeaways? What were the lessons? What did you learn at Valley View that you think was important for practice, like for working with people?
Well, I think one of the most important things is don't always be the caregiver. Let people contribute in that area too. Let the patients contribute in that area too. Number two, I would say another thing is people are people. We all have maybe something physical wrong, or you have mental health problems, but underneath you're a person that deserves respect and should be treated with respect and kindness at all times. And then what I think you find is that then that's the way you're treated by most people also. Another thing is don't be afraid to go beyond, step out of the box, go beyond what's happening, and be for your patients. Really try to put them first, and the word I'm looking for is just can't think of. I can't think of the word.
Be a facilitator?
Well, more like a facilitator, yes, but more of a person who promotes other, your patients, like their abilities, and I always try in patient care conferences and things to present the human side. Really humanize your patients, because in the medical model, it's really hard. They're dealing with physical and mental problems all the time, and so you need to really humanize people when you're working with them, and just really enjoy it. I found that people love music, pick up on what they love. Keep pushing forward, and gosh, it's hard because with the healthcare dollars, they keep dropping programs. Like there's not many music therapists in BC anymore. It's the lowest. Well, even rehab therapists, like rec therapists, it's the lowest number across Canada because of the healthcare dollars. But I think one of the really important things, and I keep trying to tell new students this, and even working music therapists who forget, is you have to communicate with the rest of the team. You have to do your reporting. You have to, do your care notes. Make sure that they get passed around. Do them in the patient's care book, whatever you call so make sure that people know what you're doing, because it's, if you're going to go off in the corner and do something, you think you're doing it wonderful, but nobody knows about it. Nobody knows how that's contributing to the patient's care. That's not helpful. And you have to make time for doing notes. And a lot of people don't realize that. And I mean, I was lucky in that I did a few presentations. I worked with a young fellow out at UBC, and we did a little video. And I happened to, and the volunteer coordinator saw it. And so at one of her presentations, one of her, introducing new volunteers, she asked if we'd show it. So we had the patient came down. He was a young fellow, and he was really proud of himself that he'd done this. And we presented this video. It was 10 minutes long, and the president of the hospital happened to stop by then. So it was like, what a boon. It was just a perfect opportunity for them to see, how important music therapy was. So that's music therapy was a big part of UBC's program out here for a long time. Sadly, it isn't anymore.
Because of funding?
Yeah, funding got cut, yeah.
So, is there anything that we haven't covered that, I think you've certainly articulated the value of music therapy. You've told me some good stories about Valley View. One thing I'm not kind of clear. So you would have this cart with your musical instruments that you push around.
Yes.
But was there a rec, like a therapy room that you would use in the main Valley View?
Yes, there was, and it was the recreation room. So some of the programs I had in that room too. The rec therapist office was there, so it wasn't always. So if it was people from the, we used to have a band there, and then a program for people in the hospital if they could somehow come down. But otherwise, I went out to the cottage and did the program in their living space. And so that's why I like to have the instruments, the record, the tape player, the music, heaven knows what else, on my cart that I pushed, yes.
Yeah.
Oh.
Yeah, no, that's, yeah, I think that, did your training at CAP, like, did it really prepare you for what you faced when you got to Valley View?
I don't think so, no. I don't think so. It prepared you for how to use music. But I mean, nothing prepares you for going into a facility. We did do practicums, and I did one at Riverview, which was really hard. And then I did one with youth, and I did one with children at the school. So I had all 4 groups of people that I worked with. But I don't think anything really quite prepares you to be on staff and be responsible for like a whole program. But that develops. I think that's true with any group. Even OTs, like, sure, they've got their basket of goodies that they know what they should be doing, and physios, they know, but to start something and build, it's an on-the-job learning experience.
But you had raised 2 kids.
Yes, exactly, yes.
Transferable skills. So I didn't know you'd been at Riverview. So when were you at Riverview?
Well, I was just there. I just did a practicum,
like a few weeks or something?
Just a day a week for a term. So I think it was maybe 10 days.
Yeah, and was there music therapy at Riverview?
No.
So you were.
Fortunately we did it with, it was another person. I had another student, same as I was. We did it together, and that was, I have to say, I went on Monday. We went Monday, and there was a rec therapist there, and he played the guitar, and so we really followed him around mostly, and then did a program, a couple of music programs, you know, when it was organized. But we didn't. I think it was my first semester, so I didn't. It was more of a just following around as to what could be done.
I think there was a place called Pennington Hall.
Yes,
yes.
yes.
Is that where you did your?
Well, that was that. Mostly the rec therapists went again to the different areas, but that was a big hall where they had dances, and there was a tuck shop there, and was it bowling alley was there? They had, well, they could set up recreation. Yeah, it was a really lovely facility actually for people. But yeah, and we did. I know the one program that I did do that's where we did it, and we had a lot of Native young people in that program. So I just remembered, like, that was just one session that we did.
Young Native
Yes,
patients?
yeah, there were at Riverview at that time. At least, I mean, by a lot. I would say 5 in the group. You know, maybe there was 8 people in the group.
I
So
wonder what their situation
yeah,
what their stories.
they were kind of like a schizophrenic behaviors. So it was pretty frightening.
Pretty, like, I don't want to make a lot of assumptions, but residential school,
Yes.
schizophrenic
Yeah.
behaviors would
Yeah.
possibly be, there might be a
Yeah, it was.
connection there. Wow. Yeah, Riverview, most people I've talked to are not so positive about it.
Yeah.
At that time, but it's hard. I mean, I'm sure that the staff there were trying
They're of course, yeah.
just
I don't even, you know, I won't even think about what about it. I tried not to think, but I would come home after Monday and barely get over the week till, you know, maybe have Saturday and Sunday. Sunday night I'd start weeping again about going out. It was so sad. It was so hard. I mean, you just can't imagine.
why was it so hard, Doreen?
Well, the patients, it's so sad. They were really in bad shape. And all the wards locked, double locks. Staff walked around with a big keychain, and you locked them in and locked them out, and it was bad. There was one ward upstairs that was all decorated as a nursery, and these were all adults living there. Yeah, it was.
But you went and worked at Valley View.
Yeah, well, Valley View wasn't as bad, I have to say. Yeah, it was. I don't know why.
Well, the cottages sound okay.
Yeah, yeah. I mean, they had some really good, you know, for that time, they were working through things. And
different atmosphere, because it obviously was quite separate.
yes, yeah.
And could have had a kind of different culture altogether, and people may be kind of negative about the elderly, but they're usually kind to them.
Yes.
There's a sense that we should be kind to the elderly
Yes.
people.
And I think, you know, like at Riverview, there was Crease Clinic where the extremely acute mentally ill were sent. And, you know, and so that there was all sorts of really acutely ill people there. So I don't know how nursing staff managed, actually. And I don't know, did some of the music therapists work there after? I don't know if they ever really got a music program.
I don't know.
Yeah.
I don't know anything about
Yeah.
about the music therapy at Riverview, but I might not know. But I do know that I understand that one of the reasons Moira left Riverview was because Valley View, I mean, Riverview was downsizing.
Yes.
And so they amalgamated the two administrations, and that wasn't a good situation for
Oh,
her
okay.
anymore.
Yeah, I
So
can
she
see that.
moved on to other stuff.
Right.
She's a bit of a star anyway.
Yes, yes,
Yes, yeah.
definitely.
I mean, do you think Moira was a feminist?
No, I wouldn't. Mind you, um, you could say, yeah, in that yes, she put forth as women, well, especially dealing with administration and things, and she put forth women's issues quite clearly, and wasn't afraid to get into the area of admin, executives that wouldn't have had women before. So, yeah, probably she was. She wasn't in the sense that she wasn't the bra, burn the bra type, but she certainly, but because she was so focused, let's face it, her focus was.
Yes. Very passionate
Yes,
about
yeah.
what she believed in.
Yeah,
Well, I'm
sure.
looking forward to interviewing Carrie, and I'm hoping, and interviewing Joyce on Friday, and I am hoping to talk to her son Mark on Thursday morning.
Oh, good, yeah. I tried to find, there was a OT at Valley View. Oh, gosh. Why would I just all of a sudden forget her name? Who was very creative, and she also came out to UBC, and I worked with her out at UBC for quite a while. And I tried to locate her for you, because I thought she would be a wonderful person to interview, but I couldn't. Nobody knew where she was. She got married, is the problem, and moved up the valley. Yeah.
Because they changed their name.
Yes, that was it, exactly.
I was trying to find this Pat Kreider, and I think that's her name, and I could find her in sort of the professional directories. It appears that she plays bridge.
Oh.
But I couldn't, I mean,
Yeah.
she's not in the directory, right? But I would, I'll be back in June, and we have a place on Hornby.
Oh, lovely.
So we spend our summers here. So it's not impossible for me to come back again and interview people.
Yeah.
Did you have any photographs or did you have any stuff? No, you moved.
No, yeah, yeah. I couldn't even find my record that I know I wrote out. And anyhow, the gal's name was Jilly Cornford. If you ever, I'll kind of keep looking, because.
Yeah. So was she at Valley View? Or
she was at Valley View.
Oh, what?
Yes.
Was she one of Moira's people?
Yes, she was.
Yeah.
And she's a very creative person.
Yeah.
And then she also moved out to UBC like years after I was there. And yeah, so I looked in the OT directory, and
yeah.
I don't know who, if you get to talk to an OT at all, they might be.
Yeah, because OT interests me. I have this good old friend who's an OT, right? And so I was visiting her on the weekend in Victoria, and I said, so give me the scoop. And she had worked at the Douglas Hospital in Verdun. It became the Douglas Hospital in Montreal as an OT. She was trained in Boston. So she was the one that told me that Moira had probably done OT/PT at
yes,
UT.
yeah.
And she said, oh, at the hospital, the psychiatrists were sort of like the daddies.
Yeah.
And she said the nurses were like the mummies. And she said, us OT people, we were like the kid.
Yeah.
And I thought, so she said that the dads were kind of distant and detached, but they were kind of benevolent. But she said it was the mums that could be so difficult.
Yes. Oh, well, that's for sure.
Yeah. But it sounds like you did good things, and
yeah. Well, it seemed like, when I look back on it, now I can see, lots of really positive little things that happened.
Was there anything that really didn't work?
No, not really. I probably didn't try it, because things like this one group that we had in the rec room kind of thing, and the people came down, and the fellows, and it was like, oh, remember this tall